We are looking at what we can do to expand testing into the communities. I had a meeting with Latino communities leaders. I'll be meeting with African American community leaders to talk about what we can do to bring testing deeper into the community. We've done, I think it's over 145,000 tests so far. And that's total tests. That includes some people who've been tested twice. We are in the 118 range, I think, for testing in general of unique individuals.
I do want to highlight that it's important to note for the data that we have that does show racial and ethnic categories for testing data. We actually see the highest number of tests in the county overall, as well as those top 10 zip codes that we've mentioned before. The highest number of tests have been in the Latino community. And in addition to all the other categories, we have seen improvements in terms of the number of cases on a daily basis. If you think back to June, we were seeing averages of 300 a day. Now we're at the point where it's anywhere between our 3-day averages are somewhere between 50 and 75. So that shows significant progress across the board. As time has moved forward, we have seen the percent of residents tested increase. We've seen the number of tests offered and taken increased. We've seen test positivity rates for all geographic areas as well as racial and ethnic groups decrease over time as well.
We're experiencing the same issues, though, everybody else is experiencing. This is a national problem. It stems from underlying social inequities. The fact that we have these test results doesn't change the fact that people are getting sick for a reason. These are often cases, particularly in the minority communities, they are the so-called essential workers. I say so-called because they don't get paid like they're essential. They just go to work and you decide that they should not stay home. But they're the people who are the most exposed and they bear the greatest risk in this. So we're aware of that and we're continuing to work on that.
We continue to push, as the county executive mentioned, conversations to talk about how we create policies that create effective change to remove those systemic factors that are predisposing folks to getting COVID more frequently, as well as having worse outcomes.